Escape to the action at Seminole Casino Hotel Immokalee. It is Vegas style 24/7 because just like Vegas, Seminole Casino Hotel never closes. It is pure entertainment anytime you want, and it is truly where paradise wins.
Back with us today from University Urology. We are so happy to welcome back to the show this morning Dr. Scott Caesar. Good morning.
Good morning. How are you?
I love having you on the show. You always kind of just tell us like it is. You're very big about educating people. And this morning we're going to talk about kidney stones, which how common are kidney stones? Do you see a lot of this in your office?
Well, it's the summertime now, so it's a lot more common now.
Is it really?
Yeah, I mean, because it's hot weather, people are dehydrated, not drinking a lot of water. So it's very common, happens in men and women. It used to be a lot more men.
Which I think some people don't know. I think people just assume it maybe more happens with men, which you were telling me kind of back in the day, it used to be more of a man issue.
It used to be kind of an 85 to 15% male over female, but now over the last 30 to 40 years, it's kind of grown more to a 50-50 sort of thing for a lot of factors.
Wow. Talk about I'm interested to know. Talk about why you think more women are getting it.
Well, first of all, it's genetics. That's the number one reason that people get kidney stones. If your father, mother had kidney stones, your grandfather, aunt, uncle, this puts you more at risk because it's just a genetic factor. But there are a lot of things now that have made people get them more often, and a lot of it's due to diet. You know, in America, we don't have the best diet in the world. With that, you know, obesity trends are up. There's a lot of other reasons, and a lot of dietary factors are factoring into men and women now getting a lot of kidney stones.
So weight can have really an impact on...
Yeah, it's a lot of things that people eat. I mean, first of all, hydration is always the key. So stay hydrated, stay hydrated, stay hydrated. Drink a lot of water to help you not get them. But depending on what stones you have, and when you pass them, you can get them analyzed to see what they're made of. There are a lot of foods that can cause them. You know, animal protein, which we eat a lot of here in America, can cause a lot of high acid in your urine, which makes you more prone to kidney stones. There are other things like a lot of nuts and a lot of processed foods, a lot of salt. Salt is a big factor because what happens with salt, you start dumping out of a lot of things in your urine that help you prevent kidney stones, and that makes you more prone to have them.
So yeah, I was gonna, if you know that you're genetically maybe more inclined to get them, are there certain, like, make sure you're on a low salt diet?
Yeah, I mean, you can go online or talk to your urologist about a stone diet, and there's specific things based on the stones you have that you can follow. For example, if you have calcium oxalate, which is the most common form of stone, you can look up calcium oxalate diet, and you'll see that everyone thinks that calcium's the bad thing because your stones are made of calcium. That's wrong. Calcium's good for that because you want the calcium to kind of bind all the other molecules and get excreted out of your urine or be absorbed in your body. But the oxalate is what's bad, and you can look up high oxalate foods like sweet potatoes, chocolate, peanuts, a lot of things like that. You can also see that eating some other foods can help you, like taking citrate, which is a lot of lemons. So if you put lemon juice in your water, that can help you prevent kidney stones, things like that. So,
well, and how do you describe what a kidney stone is? And there are certainly different kinds.
I always say it's funny. Patients know. I mean, if you had a kidney stone, you know what a kidney stone is. It's always that first time that people don't know what it is. They have, you know, abdominal pain, nausea, vomiting. The really bad ones can have fevers, chills, get really sick. So you go to the emergency room because you feel.
Do the symptoms escalate pretty quickly?
They can, but a lot of times the sharp pain, because what's causing that pain is a stone getting stuck. You know, because the kidney has a small tube called the ureter, which connects to the bladder, and that's where your urine moves through. When those stones get stuck in that tube, urine can't pass through the stone.
And they don't have to be very big, right? I mean, they're relatively small.
What I tell people is 5 millimeters is the cutoff point. If a stone is 5 millimeters, you have a 50-50 shot of passing it on your own. Anything that's over than that, less than 50% chance. Anything smaller than that, greater than 50% chance.
So what do you do when you can't pass them on your own?
Well, when you can't pass, let's first talk about when you can't pass them on your own. So, you'll probably get a CAT scan. That's the number one way to, diagnose them. And, when you go to see a urologist with kidney stones, they'll look at the size, the location.
Do you have to go to a urologist, by the way, or is this something?
Kidney stones are generally only treated by urologists. I mean, your general practitioner can give you, general advice. Here's, drink a lot of water. Here's some medicine for your pain, things like that. But they'll usually
your first step is going to be to see your urologist, and then you figure out how big they are.
Right. So, we'll look at the scan. We'll see how big the stone is, where it's located. If it's small enough, we'll try just medical expulsion therapy, which is just trying to pass it on your own. There are medicines to help you. One of the most popular ones is Flomax, which men take for big prostates. But another thing that it does is it kind of can make that little tube, the ureter I was talking about, kind of try and push the stone out on its own. So if the stones are small enough, you can try medications like that, obviously staying very well hydrated as well, to try and pass the stone on your own. Now, like I said, 50-50 shot most of the time, sometimes less, sometimes no. And if you don't, that's when you get into interventions to kind of fix them.
So there are surgery. We have a little less than a minute left, but there are surgery options. You say pretty easy to do.
Yeah, there's some very simple with a lithotripter, which is using a machine to kind of break them into smaller pieces that brings you on the back. There's a scope that you can put up, and we can use a laser to break them up into small pieces, and we can pull the pieces out. There are bigger interventions if you need it, but the good thing is that 99% of the time it's an outpatient procedure. You get it done in you're done in an hour. You go home that day, and usually it's pretty easy to follow up afterwards.
Well, as we wrap here, what's the take home? What do you want people to understand and really?
The most important thing, the most important thing now is drink a lot of water. I mean, stay hydrated, all you can. Always carry around that bottle of water. Drink a lot. If you've had kidney stones before, know your symptoms. If you start having that pain, the nausea, the vomiting, get treated, get seen right away, because you want to get it sooner rather than later. All
right, and then if anyone wants to find out more about you or your office, I know you're here all over Southwest Florida, primarily in the Cape too. But
yeah, Cape Coral, Fort Myers, North Fort Myers, Lehigh. Everywhere all the time.
Yeah. Dr. Caesar, again, we love having you here. We love how you love to educate people. You've certainly helped us this morning. So we look forward to having you back. Thank you so much, Doctor. We, of course, will put or send it over to Stephanie.
Up next, why it's time to buy. We break out the top 10 ways on how to get the best deal when it comes to buying a home in this week's Real Estate Best Buy.